All right, as we said off the top, the World Health Organization has now declared coronavirus a pandemic. It means the disease is prevalent throughout an entire country, continent, or the entire world.
However, there are reports suggesting that kids are not particularly vulnerable to the virus. Scientists are finding coronavirus to be relatively mild among people under 19 years old. Pediatrician Dr. Rosen Crosby, she joins us here to help us sort through the facts. So welcome. Thank you so much for your expertise and perspective. So let's start with that fact, that are kids safer than adults?
We think that they are, and we think they are probably for a few reasons. One is there are viruses in general, and we have the data from China that are really substantiate that the kid percentage of cases that they at least detected or were sick were very low, in the 3% or less. So we think, well, maybe there's a few reasons why. There's a couple types of coronaviruses in the big coronavirus family. They're the types that cause upper respiratory, which are colds. Then there are the type like SARS, MERS, and this one, SARS-CoV-2, that cause more lower respiratory tract. So kids get these regular coronaviruses all the time. We do viral panels, and they test positive for coronaviruses. There's 4 that we see regularly. And maybe that gives them a little immunity. We don't have enough information yet. But also there are viruses in general that kids do better with than adults. Think of chickenpox. Adults do much worse with chickenpox. EBV, which causes mononucleosis. Kids under 5 get a cold, or you don't even know, they may have a subclinical case, and older people do much worse. So we're still looking into why.
So it's the reason why we take that mild, the word mild, with a grain of salt. Because mild could mean a number of things, really.
It could. And kids probably with this, and what they're seeing is they get more mild illness like a cold. So they may look fine or have a very mild cold and not look very sick at all, but could have it. Or maybe they are carrying it and not really exhibiting symptoms, but could potentially pass it.
So you just enlightened me when we're talking about the older population, elderly, who can be more susceptible, high-risk group. But it doesn't matter if you're 60 years old and extremely healthy, you're still at a higher risk.
You're still in a higher risk group, but even with the flu you are too. Older people in general, that's why we always say if you're over 60, for sure get your flu shot anyway, even if you're healthy, because in general it's a lot of those, it's like the flu.
I feel like you say this every time you come in, which is wash your hands, wash your hands thoroughly.
Properly, right? So 20 seconds, we talk about singing the ABCs of the happy birthday song, but also people aren't using hand sanitizer correctly either, because when you use it, you actually want to do the same 20 seconds.
Really?
Oh, yes, don't just be like we saw in that little kid's Sandy video. They were like, done. No, 20 seconds, same kind of thing. So you want to do that, and don't touch your face. So your mucous membranes are what the virus is like, eyes, nose, mouth. So during the day, don't touch your face. It's important. Clean surfaces. Teach kids, and you yourself, cough into your elbow, sneeze into your elbow. When you open doors, use a tissue, especially like public places. Don't touch escalator rails. Use the tissue to open doors. When you dry your hands in a public bathroom, use the tissue that you dried, turn off the sink, open the door. So just avoid touching things as much as possible. Sleep, drink water, eat well. Get a flu shot. That's also important too.
Okay, and a quick tip for parents: if your kids are sick, then maybe keep grandma and grandpa away.
Right. So I think in general, if you're sick, what we're telling everybody is stay home if you're sick. Just don't go out and about. But right now, since we don't know everything, we're advising that grandparents probably shouldn't come around when the kids are coughing and snotty and drippy right now. So just as an extra precaution until we have more information.
Dr. Rosen Crosby, thanks.
Thank you.
As always, for coming here, lots of information. And for more information on kids and health, you can also connect with Dr. Crosby on Instagram. It's Dr. Rosen Crosby.
And we're not done with you yet. You're going to join us for our digital town hall today, as you've been partaking, I hope, with us on our Facebook Live page, Fox 11 Los Angeles page. Dr. Rosen Crosby will be joining us to take your questions on kids and just health in general.
Yeah, if you want the latest on the coronavirus, be sure to join us on our Facebook page. Again, just search Fox 11 Los Angeles.
And we'll see you in just a bit.
Yeah.